2015. Okay. Who wants to go first? Go ahead. Come on up, Alejandro.
Okay. How are you doing?
Okay.
So I wanted to ask if you might have received some of the numbers already that I had sent prior to us scheduling the appointment. Okay, just wanted to make sure. I wanted to make sure I wasn't presenting anything too new. So I'll just kind of go ahead and point you in the direction of the colored version of that same document that I brought along today. And I had been preparing some numbers with regards to your proposal and was going to ask, if you might be able to indicate to me where your spend was last year and where your spend is projected to be.
Okay.
So far you should have 11 months that you can account for, or 10 months, excuse me, if I may sit down. So what I was hoping to have an indication of so that I might be able to understand where we are with regards to price, would you have an understanding of how much you are spending total month after month on your current health plan?
Deb, can you get the totals where we're at as far as for your expecting United Healthcare and any insurance?
That should have been on this report that I shut down. That's through October.
Well, Grant?
As far as premiums,
Well, yeah, as far as premium, United Healthcare.
what was that report that's on the list that's printed out?
It was right here. Sorry, we've had trouble finding out. That's why we have questions. I had to do some research to try to get answers.
I understand.
Okay, so far I've got, if I'm correct, our yearly premium is $137,226.12.
That's what I have calculated exactly.
For the gold. And
For
then
the gold.
For the other one, it'd be $376,567.44.
Yeah, basically it's that group grand total on
Okay.
each page multiplied by 12.
Right.
Now that would be all of your costs. That includes, so this number here,
You have one for Corinne? Yeah. Alejandro?
yes, excuse me.
Sorry.
Is this for the following year?
2016, the one that is right ahead of us.
You do know we're under contract with another company and cast a 60-day notice period. Are you aware of that?
I'm sorry.
We're under contract with another company that renews at the end of the year. And if we were going to get out of it, we had to give them a 60-day notice period. So that would have been November 1st, and we're outside of that. Did you know that?
I wasn't in this process. Nobody had shared with me that there is a stipulation there, and the reason that I wasn't aware of that is because with Blue Cross and Blue Shield, we allow our groups to give us a 30-day notice, and in my 8 years working with other plans, 30 days has been adequate notice for those groups. And I will add to that point that if you move forward with Blue Cross, we will not lock you into an agreement for a year. You will do business with us month to month. So long as the terms of that arrangement are agreeable to you. There's no sense in keeping you in a benefit program if it's not serving you and your employees the way that it should.
I understand.
He's meaning with frivolous claims is what they're talking about. But my question is after we went through the numbers, it looked like we have paid significantly. By the end of the year, on the projections, I come out with a totally different number. So I need to, that's why I want to talk to you guys. So,
Well, from last year's projection, I had calculated that there was approximately a 16% difference between what we put on the table last year and what you ultimately took on, which if the numbers were correct, you would have paid approximately $80,000 more for your current plan. So I'm really hoping that you will give Blue Cross and Blue Shield a consideration because, you know, $80,000 difference annually is a lot of money. If there are differences in cost for 2016, well, we would hope that you would not leave that money on the table and allow us the opportunity to save you money as a county.
yes.
This is going to be the most recent, it's
Okay.
30th of
Do
October.
my figures agree with yours on gold?
Yes, they do.
Okay, all right.
Yes, they do. That is exact. I made it a nice round number.
Oh, my.
Who have you been working with out of this board directly?
I've been talking to her. I started talking to her when you guys had come in too. It's clear back in, well, last year I talked to her. And I
They
started talking.
contacted me
Yeah.
directly.
We raised the taxes, of course, you know, 7 mills, and we only did a 3% cost of living.
Well, I also was here at the meeting when Freedom Claims was here with other employees sitting in this room, and you told them that they were doing a good job, and every other employee in the room said the same thing.
Yeah, so that's correct. But
Okay, right now, legal advice to this board is we're under contract.
Okay, let me ask you this: what if the projections of what
Legally, I'm not a commissioner, I'm a county attorney. Legally, we're under contract.
Well, in regards to that contract that you have, I understand that the terms are to allow you 60 days to, if you were going to terminate this.
The terms of the contract are between this county
Oh, sure.
and that company.
Oh, no, I'm not inquiring with regards to that. What I would want to ask is, how early is this county getting their renewal to allow them the
Ask the board that
ability to-
question.
No, I'm just,
Ask the board
I don't
that
want it to
question.
be, I'm not trying to impose.
But you need to ask the board that question.
Okay, so if you have an agreement that forces you to give 60 days to end your contract, how far in advance are you receiving the information for the following year that would permit you as commissioners to make a good decision about how you move forward?
Well, we weren't ever none of us commissioners knew there was a 60-day notice. But we were, when it was projected at $470,000 at the end of the year.
Did we sign the contract with Freedom Claims? Who signed it?
Miss
I think
Lindstrom
I did. After the decision of the board, the county clerk has the authority
Correct,
to sign
correct.
documents based on their decision. So it was.
Well, Mr. Pullen said he didn't know about the 60 days. I was making sure the board was presented with that contract.
Yeah.
They were.
Okay.
But you guys project the end of the year to be $470,000, correct?
That was the projections that we had at the beginning of the year, that the reports that we have is that you're under projected, what we projected at the beginning of the year.
Well, see, because when I did a total between United Healthcare and Freedom's Claims, and then we did an estimate on the average for October, November, and December. The total for Freedom's Claims goes out to $216,043.43. When we total up the United Healthcare and then average it, the 1 month we had to average on that, we had to average 3 on this one, we come up with $321,919 for a total of $537,962. And understand,
Are these the board's calculations?
These are I went to the treasurer to get these.
But are those the board's or are those your calculations? What I'm asking.
Well, I calculated these up, yeah.
Okay. Have you guys seen those?
Yeah.
Because she has all the information regarding ours, but we don't have any of her information. So she has had.
And when this process got started, I was not aware of the 60 days. What I'm trying to do is I'm just trying to do the best job for the county. period.
And I just grabbed the information from public records. I haven't been provided anything. I just wanted to make that clear. But because this is a municipality and there is a certain amount of information out there that I can use, that is certainly being considered. Now, I'm not here to cause I'm just here trying to present the numbers. I'm
Right.
a representative of my company.
That's
I
you're doing
certainly
your
don't
job,
want
correct.
to, be, I don't want to cause any trouble, just trying to deliver the proposal that I have. But it is clear that there would be savings last year, and there would be savings moving forward. As an entity who answers to the taxpayers of this community, I just want to ensure that I give you the numbers that I would honor for an entire year. And I would also extend to you, the county, the ability to exit that agreement with just a 30-day notice, primarily so you can give that notice to your very own employees, the alternative to understand what's happening with their benefits should you not be happy. I feel that what is difficult about this situation is that if you are not getting your renewal 90 days out, how could you provide 60 days termination? That's something that I'm questioning.
As a commissioner, in my opinion, it would be the duty of a commissioner around budget time, when you're putting numbers together for the following year, to request those numbers, if you want an answer from me.
Yeah.
Those numbers typically are not going to be available from any carrier.
To
until-
request them as soon as possible, that they're available. If any carrier can't give them to you at budget time, then we know that's no different. But as a commissioner, if you're asking me, and you directed it at me, I thought, it's your job to get those numbers as soon as possible.
And when were those numbers for 2016 delivered in this year's renewal? When was the renewal delivered to the county?
They received their renewal in the mail.
Did you see the renewal?
Pardon?
Did you see the renewal? I never.
That
I know.
just
Did
came
you?
in.
I know when we were working on budget and we looked at projected, that we had
The final numbers. When was the renewal with the guarantee for 1 year provided? That's really what I'm hoping to.
Right.
We're not having that.
Oh, they would have the information.
Right, I
see.
understand that.
She's not giving us
Well,
Certainly more than 60 days out of the effective date so that you would have time to make a, decision about
Right,
the contract,
right.
I assume.
I just want you to be clear, I'm the county attorney.
Oh, no,
My
know.
legal opinion to the board in front of you before you started your spiel, and I walked in a minute late, is that this board is under contract. And I'm not going to advise them to breach contract.
Oh, sure.
Fair enough? My job at that point ends. As far as getting the numbers, this, that, or the other, frankly, no disrespect, I don't care. My job is to say, we're under contract, protect the county's liability, we're not going to breach it. If a commissioner or a group of commissioners wants to go against the legal advice of the county councilor, then they can do that. But I wanted to get that on the table. If you're talking about 2016 numbers, my advice to the board was, why are we even talking about that? We're under contract. And that's where my job ends.
Legally speaking.
Legally speaking only.
Is there any way to consider being able to not honor this contract if the information to the county is not provided timely?
Well, quite frankly, that probably should have been discussed before we asked you to come out here from Topeka.
I'm not traveling from Topeka.
Oh, okay,
no
thank
worries.
God. Yeah,
I'm a local representative.
Okay, good,
I'm
good.
regional.
very good.
No, and, so I'm just here wanting to deliver. It appears that there's savings from last year. If you would have moved forward with us, it appears that there is money to be saved in this year. And as has been the case in years past, I hope that, I will be able to continue to have the opportunity to put numbers on the table because I will make the same assumption I made last year in that there would be money to be saved by the county as well. So that would be, we would go into the third year where we were competitive, we did have an opportunity, but being that maybe you don't have the information you need before you get yourself into a legal situation.
Well, you provided us information at one point, and we're scheduled to come out here. Have you talked to this board before?
Certainly.
You came out here and talked to this board before?
Yes,
Certainly.
not these two though,
Not this board.
not this.
Okay.
Last year at the same time
With two
of the
different
year.
commissioners on there,
Exactly.
correct.
Mhm. And due to the nature of the timing, we had also provided this proposal in anticipation of today.
Okay.
So might there be a date that you would have formally received your renewal?
I received that, but it doesn't have a date on it, so I'm not sure when this was
It
sent.
was mailed prior to November
Yeah.
1st.
It wasn't available at budget time in August.
No, that I wouldn't be necessary. So prior to November 1st.
Well, this is just the numbers.
So that was sent in the mail. When was a representative here to present your renewal formally? Not in the mail, but.
Okay, at this point, it's my advice, we're not answering these questions. No.
Okay, that's okay.
Okay,
I
okay.
was just because, you know.
That's my job. We're not answering those questions.
Okay, because I guess I would just, say that part of my process would be to make sure that I deliver the renewal in person so that you might have time to decide what direction you would go into every year. But if I don't show up here before the 60 days that you have to terminate your agreement, that would make it impossible for the commission to make a good business decision
Correct.
year over year.
Okay.
And that's what I'm trying to address with regards to the 60 days. If you didn't have somebody in front of you 60 days prior, then how were you ever going to be able to make a decision about renewing and terminating before 60 days were up? It just seems that there isn't even enough time there for you to make a decision with regards to that.
Just go over, if you want, just go over what you're offering.
Sure. I mean, do you think that it would, should I go over these
That's up to the
benefits? I
board.
mean-
That's up to the board, ma'am. I've given them my legal advice.
Okay. Well, what we have presented is a gold metallic program from Blue Cross and Blue Shield of Kansas. It is what we consider a comprehensive option. It offers a deductible, which is outlined specifically in the in-network column. It's a $1,500 deductible, then it moves into an 80/20 co-insurance, which would be right there. The co-insurance is 80/20. It has co-pays at $25, 5 per member. And then the maximum out-of-pocket, the annual maximum out-of-pocket would be $3,500. Now, what I will stress about this program is that co-pays for prescription, co-pays for office visits, and any co-pays for ER or advanced imaging would be applied to that $3,500 out-of-pocket. This will be a similar program that I will continue to present to you as decision makers so that we can become more familiar year over year when you take a look at this. What we would be offering. Certainly, if you would want to offer a richer program, it would be more expensive, a little bit more costly. But because I believe that there are savings to capture, I think that there might be room for discussing that as well. From 1 year, if you're going to see savings to the gold, I think we'd still have a little bit room to even offer you something a little bit richer. But this is typically where I start. Now, I brought an option that is considered a silver metallic option. I included it in your packet as well. But this would be less of a rich benefit, and since there are already savings that you might be able to capture, this would not be my recommendation nor the direction that I would go in. you have any questions about the benefit per se, or?
No, I don't.
Well, you like it? That's wonderful to hear. I feel that the gold benefit has been where a lot of our groups have chosen to move towards as they either lose their grandfathered status or as they explore changing their benefits. In the region that I represent, which is Northwest Kansas, I have had the majority of my groups move towards this very gold plan. It has had some modifications since the last time I presented it. So we increased the annual out-of-pocket to $3,500 from $2,800 last year. I don't know if next time, hopefully if I have an opportunity to come out here for next year, if it will be changed or if this will finally be the design that we're going to keep moving forward. The only reason I caution that there could be a change is because as we continue to implement the Affordable Care Act, we have had to, change the benefits just a little bit more because it was a brand new design in 2014, and we like to build upon a process and maybe tweak little things that will help with cost or will enhance the benefit. Another example would be that last year when I presented the benefit, I wasn't able to offer you optometry for adults within that program, and this program that I brought out to you now includes optometry for adults. So that is a tremendous enhancement because, of course, we think that providing dental and providing access to optometry allows your employees to take some wellness initiatives that improve their health. And with regards to vision, I think that boils down to safety, which I think is very important for the work that you do. Given that you are in a contract that you are not able to get out of, I just really would like to say that I am very grateful that I had the opportunity to put our numbers on the table. We have demonstrated, now a few times that we can create some savings, and so hopefully we can just continue to do this so that maybe the third year we might be able to gain your business, but I'm still very happy to come out here and visit with all of you. If that's all, then that I don't have any.
I don't really have any questions. I want to clarify something. At the 10/30/15 meeting, City Superintendent Landberger and I, were you at that meeting?
Are we through here? What are we doing?
We're done with her.
Okay.
I want to say something.
Okay.
You said what you wanted to say. I'm going to say what I want to say. Were you at the meeting on 10/30? Mr. Landberger and I both, at different times, we can go back in the deals, ask Ms. Lindstein for the total numbers.
I don't remember
Because we
exactly
both
what
did.
happened. Okay.
Go beyond there. We did not. She couldn't get them for us. So how can we make an educated decision? And it's on there.
We need only executive session, contractual.